Hi guys, Dr. Gillard. I thought I'd throw together a quick video on the tibia and fibula. This one's going to be a little more advanced, and I did another one that wasn't quite deep enough, I don't think. So if you want a deep video on this with all the nooks and crannies, this is for you. So here we go. This is obviously the tibia. You can tell because it's a big fat bone compared to the skinnier fibula. Remember, it's a little fib. That's how you can remember that. So let's talk about the tibia. Let's start at the top here. This is an anterior view, by the way, of the tibia. And let's zoom in here. Okay, so first thing we can see, well first, even before that, this is the shaft of the tibia. And starting at about this big bump, which is the what, by the way? Tibial tuberosity. Starting about here, this entire surface is the condyle of the tibia. So we have a medial epicondyle, or not epicondyle, there are no epicondyles. We have a medial condyle and a lateral condyle here. And the medial condyle and lateral condyle give rise to some stuff, including the tibial tuberosity here, and we'll look at some more stuff from a S to I view, or superior to inferior view, in a moment. So let's actually try to zoom this in even a little more, because we see something laterally here already. We saw the tibial tuberosity for insertion of what? A patellar ligament. You can call it patella tendon as well. We can see a nice little smooth surface here. Let me try to bring this up. You see that? What is that? It's on the lateral tibial condyle. That's Gerdy's tubercle. What's that for? Well, that's where the iliotibial tract actually inserts. So Gerdy's tubercle. And that is about all we can, for our purposes, we need to see. So let's take a look S to I now. So I'm going to flip this over. I guess I'm going to have to kind of hold it up a little to the camera. Maybe I'll back out just a little bit. Alright, let's give that a try. So, the whole ball of wax. So all this stuff is coming off of the condyles. So the whole thing is called the Tibia Plateau. And I should, before I go farther, my references here are Netter, Gray's Anatomy Drake, and Gray's Anatomy Strandring. So you can't go wrong with those three. Those are the big three, so that's where all this information is coming from. Alright, so the whole ball of wax, you can't call it the superior articular surface because we have an intercondylar area here in the middle. Unlike if I flip it over, if we look at the inferior surface, now we have an inferior articular surface right here. There's not a lateral and medial component, so just an inferior articular surface here. So let's flip it back. Okay, so let's get our bearings again. So this is the posterior part here, anterior part here. So you can call it the tibial plateau. So we have two articular surfaces for the femur. So we have a medial articular surface here. So this is the medial articular surface of the tibia, and the lateral articular surface. They look like little helicopter landing pads, I call them. Technically you could call them, you could also call them facets, by the way. I think Netter actually calls them both articular surfaces and facets. So you could call this medial one, you could call this the medial facet of the superior articular surface. If you want to be 100% correct, that's the way you could say it. So this would be the lateral facet of the superior articular surface. But in real world, you just call them the medial and lateral articular surfaces of the tibia. You can also call this the medial tibial plateau and the lateral tibial plateau. Alright, in radiology we often use that, but that terminology is not used in Drake, which is your mandatory student book, Drake for students, Gray's Anatomy for students, and Netter, which is pretty much the Bible for medical, physical therapy, chiropractic school. So now in between these two articular surfaces you have an intercondylar area. Intercondylar area, and that can be split up into pieces. Posterior intercondylar area, guess what arises from the posterior intercondylar area? Posterior longitudinal ligament. Anterior intercondylar area, guess what arises from here? Anterior cruciate ligament. And the space in between is called the intercondylar eminence. Why intercondylar? Because we have a condyle here. Lateral condyle, medial condyle, intercondylar, in between the condyles. Intercondylar eminence, and even more specifically, we have a lateral tubercle and medial tubercle. So this is the medial intercondylar tubercle, lateral intercondylar tubercle, and I have definitely pinned those before on tests, so make sure you know those. Okay, what comes off of here? The attachments for the MCLs, medial collateral ligament and lateral collateral ligaments, arise from this area here. There's two attachment points. I won't get into that too much, or any more than that. That's all I'll get into that, in fact. Alright, I think we covered that surface. Let's flip it around and take a look at the back side of it now. Okay, so now here's a posterior view. So again, we can see the intercondylar eminence right here. I guess I should bring this up a little. Now you can see it better. Okay, so the first thing, well, let's see. Let me slide down. Let me zoom out a little bit here so you can see this a little more. Now you can see this. See this line right here? Soleal line. It's called the soleal line. Let me turn it a little to the side. Soleal line on the posterior surface. And is that about really all we can see? So this which side would this be? This is the medial side. Medial condyle is a little bit bigger. There's actually, I don't know if you can see this or not, but there's a groove right here. So that's the groove for semimembranosus. Let's zoom in a little there. Groove for semimembranosus is right there. For the Palmer students, that's not on your list. You don't need to know that. And that's a nutrient foramen right down there. Don't need to know that as well. Okay, now let's flip. That's about all we need to say there. Let's flip back to the anterior view. Again, how do we tell it's anterior view? Well, we got this giant tibial tuberosity right there. Alright, let's start to slide down now and see if we can see this. We're going to talk about borders and surfaces. So this is the anterior border of the tibia. Let's zoom out. Okay, anterior border, it's quite sharp. You can feel it on your own shin. The anterior border of the tibia. Okay, tibia is going to get a little more complicated. Anterior border. So this would be the medial surface then. See, let's go all the way down. You can see the medial malleolus down here. Is this all medial surface? So what must this be? This is the lateral surface. Lateral surface. Anterior border. Let's zoom in, take another look at that. Anterior border, medial surface, lateral surface. Now if we keep going on the lateral side, you can see another line, quite a sharp line here. That's the interosseous border. So that's for the interosseous membrane that connects the tibia and the fibula. Okay. If we keep going, now we've reached the posterior surface. So this is all posterior surface. All posterior surface. Okay. I think that's about all. The tibia is not that complicated. So let's keep going down now. Let's take a look at this. So there's our medial malleolus right here. Okay, the medial part of the ankle, that's that big bump that you can feel. Let's see, what else do I want to say about that? Sometimes there's some grooves that you can see there for Tom and Dick. Tibialis posterior, flexor digitorum longus. It's not very impressive on this specimen. So what is more important is the bottom, the I to S view, because we do have a couple structures here, so let's talk about them. So as I said before, this is the inferior articular surface. All of this, what does it articulate with? Talus, talar dome, or the trochlea of the talus. Then we have this region here. This is definitely kind of heart or moon shaped, I guess you could say. So this is the articular facet of the medial malleolus. Articular facet of the medial malleolus. It's always facing laterally. Always faces laterally. So that way to the fibula. Now if we turn it over to the medial side, now we can see quite nicely the smooth medial malleolus. Okay, it's quite smooth. So this means that we are medial on the outside here. And I believe that's about all that I need to say. Oh, there is one more structure here. Let's see if we can really see it here. There is a notch. It's not very impressive on this specimen at all, but there is a notch right here. Okay, let's get you back orientated again. Okay, so there's medial. So on the lateral side there is a notch, and on this specimen it's not much of a notch, but that's the fibular notch of the tibia, and that's where the fibula would connect. Okay, that should do it for our friend the tibia. Let's go to the fibula. The fibula is up next. I'll see you in the next video.